Hey guys, Brian Holloman here, medical massage therapist at Revive Life Spa. So we wanted to talk about what do you do when you have cervical pain, neck pain, when you have headaches, when you have numbness, tingling, and burning in the hands, forearms, fingertips, shoulders. And so we're going to look today at how this occurs. So what we're looking at, and this will be our map to kind of help us see what we're looking at. So we have the spine here, and we have the nerve root that comes out of C2 through C7, and then that comes out through the shoulder. What we're going to do today is, for this particular client, we're going to look at helping release some of these injuries around the cervical spine. Remember that there are muscles all in between the joints. And there's fascia tissue, and so we're going to work on releasing all of this because they keep having pain that shoots out through this shoulder. And when they rotate certain ways, it's just painful. And it's constant. And so they're losing a quality of life because of this. And so we're going to address it. So what we're going to do is we're going to get started. And first thing we're going to do, I'm going to release a little bit of that. What I'm going to do is tack down. These are from past cupping sessions, by the way, so this is what cupping marks look like as they begin to heal. I'm going to tack down the spine because I don't want this to move at all. And I'm going to catch it into the shoulder blade. Now, what we're going to do, we're going to come in here and begin to release right along the spine. We're going to do a little bit of cup dragging today. As we go through here, we begin to release. First, we're releasing skin. So basically that broke through the layer of skin and opened it up. Now blood and oxygen's rushing into the skin. We're going to go a little deeper. 5, 4, 3, 2, 1. That takes us into the fossa webbing. So now we're beginning to release the fascia that is around the vertebrae. What I'm noticing as I'm coming through here, we're getting a little bit of wiggle room through here. So some of these muscles are trying to wiggle around. I'm going to stop them from doing that. So I'm going to go ahead and cup all the way over to the glenohumeral joint, which is the shoulder. There we go. I'm going to come right off here. There we go. Excellent. How are you holding up? Here. So back and go crossways over this area. We're releasing the transverse process of the spine. There's one. There's two. And there's three that are loose. Very good. One of the things that I'm noticing, and you can probably see this, as I'm going through him palpating, you can see how loose this tissue is getting. Now, if this client had come in, they did not today, but if they had come in with a headache, at this point in time, we would already notice the headache beginning to disappear. Because as we begin to release muscle tension and injury, the tension that creates the headache begins to go away. For him, it's going to be that pain that comes through the neck into the shoulder that travels down into the arm. That's loosened a lot. Very good. Now I'm going to extend my reach with the cups because as I'm releasing more of this tissue, I'm seeing muscles trying to wiggle around over here. So what we're going to do is come over the top of trapezius. And I'm going to come right back into the front side of trapezius. Is that acceptable pressure? Yes. Okay. We're going to catch the same side here. Injuries often occur on both sides of the body. So at this point in time, we don't really know where the injury is, if it's one side or the other. I mean, we can isolate an actual injury, but the other side may have a reaction because of the injury. So you can have muscle tension injuries all over. We're going to add a little more cream to the skin to keep it hydrated. We're going to go back to cup dragging. This is a technique that I have developed here at Revive Life Spa. We're going to go back into the tissue and I'm going to go cross-directional. And now we're going to come all the way into the neck and beginning to release. Very good. I can feel that releasing even as we're coming through here. Give it a deep breath in. Excellent. Side over here. So if you know someone who has neck and shoulder pain, or maybe that someone is you, then you might want to consider cupping therapy, medical-based cupping therapy, only at Revive Life Spa. We're going to go through here cross-directionally, begin to release trapezius and rhomboids. As the cup is going through here, it's pulling the tissue apart, releasing toxins and waste, metabolic waste, lactic acid from the areas, and then it's filling up with blood. That blood and oxygen is what resets the muscle and begins to totally change this client's life. Deep breath in. Let's be a little tender. 5, 4, 3, 2, and 1. do is go through here and release some of the facet joints through the spine. Please feel free, for those of y'all watching, if you have any questions, please ask them. We're here to help educate you as well as help you heal. We want to be your home for healing. So if that's information, whether it's body work, we care about you enough to meet you on any level that you're at. I just want to let you know that a lot of times for sessions like this, because we're cupping, the client has a disrobed shirt, but there's a lot of times with medical-based body work where you do not have to disrobe. We have a lot of the work that I do, about 75% of that work is done with clients fully clothed. They come in a yoga top, yoga bottoms, or stretch pants, or warm-up sweats, and we're able to get tissue release, injuries released, but in this instance we have to get down into the skin. So just want to let you know, for those of you that may be watching that are like, I'm not going to undress and get on someone's table, a lot of times here at Revive you don't even have to. All right. What we're going to do here is I'm going to change this around just a little bit. And they're going to be releasing. Right along the neck. Deep breath in. Coming right up into the base of the skull. Releasing right through here. Coming across the occipital lobe. And we have a pretty significant injury right here. You okay? So we're going to go into this injury. Let it begin to release. While that's releasing, I'm going to go ahead and begin to remove cups. The cups have done their job so far. And so we're actually, rather than trying to do a lot of this through cups, I want to get a deeper release through specific manual work. I'm going to come underneath trapezius. So my fingers, here's trapezius here, and here's the back side, top side, and I've come underneath the front of it. Deep breath in. Number?
4.
Okay. He's at a level 4 pain, so what we're going to do is rest here, meaning we're not going to move our pressure. It's going to stay the same. If what we're doing is healthy, we will notice his level of pain and discomfort. It'll begin to decrease. Where are we at now?
1.
Good. Good. And you can actually see, how that muscle has already released. So all of this muscle tissue, we started around the spine and to release all of that webbing and wrapping around the spine, but then we're coming out from the spine and we're releasing all the way out through here. So when you have spinal injuries, that cause numbness, tingling, burning. That is referred to as thoracic outlet syndrome, or maybe you experience just the migraine headaches from that. So this helps release all of that. We've got one more area right here that's really tender. You ready? Okay, don't let me take you above a 6. Okay, thank you for letting me know. So he's let me know we're at a 6. I'm actually coming into the underside, on the front side of the sternocleidomastoid mastoid. We're releasing the distal head that attaches at the clavicle. I'm jostling the body, but I'm not moving. Pressure has stayed the same. Is this decreasing?
A little bit.
A little bit. Okay, good. Deep breath in for me. Exhale. Deep breath in again. Exhale. Deep breath in again. And exhale. Is this decreasing?
Yes.
Excellent. Excellent. And when I come back and palpate, I can see that this shoulder is even looser than it was before. And you can even see that. Look at that. All that muscle tissue that was real tight before, look at that. Totally loose. So what we're going to do, we're going to transition to the other side. Work the other side for just a moment. I'm going to change positioning here. So just help you see from a different angle. So let's be right here. All right, we're going to go ahead and remove some more cups. A lot of times we'll have someone that will say, well, I'm just not sure about that. That looks like it hurts. Or, I mean, we hear stuff all the time. The reality of it is if you have tried a lot of avenues to find healing and you've not been able to yet, what do you have to lose by coming to Revive Life Spa? We excel with medical body work. You can get a prescription from your doctor. That helps you get a write-off on taxes. It helps it be tax deductible, as well as you can possibly get reimbursed. But also, you don't have to have a script to come. All right, what we've done right here, we're coming into trapezius, this front side of trapezius. I'm going to go into this muscle, check with the client and make sure that they're okay. Are you doing all right?
Yep.
Making sure that our clients are always remotely comfortable while on the table is extremely important. And that includes everything from disrobing and dress to places in the body that we're working. When you're on our table, it's your body and your session. It's our job to make sure that we help you. Excuse me. A little morning allergy sneeze there. We're holding pressure in this muscle. Is the texture of this changing?
It's a 4.
About a 4 now. Excellent.
A little referral through the shoulder.
So we've got a referral pattern through the shoulder. Does it come through the back, the top?
Front.
Go through the front? Okay. So that tells us that at this muscular injury here, it's creating a referral pattern that's traveling down through here. What's interesting is along the spine through here, this is where one of those nerve bundles, or nerve root as it's referred to, comes into the brachial plexus nerve bundle right through here. Jostling the muscle to get it to release. There we go. And that is much looser than before. All right. So we've got about 5 minutes left in our session. I am going to just check through here to make sure that we don't have anything else going on. And we actually have right through here, there's a high degree of congested tissue that we need to release. So what we're gonna do, we're gonna move you guys right over here so that you can still see. And what we're gonna do is have a little bit of topical lotion. So this will be more manual body work. So we're gonna come right up through here. And we're gonna come right in between trapezius, rhomboids, and pass over and come back. Another pass right here. And right here, I'm going to sharpen my elbow just a little bit. And you felt him flinch. We're dropping right down in here. And we're going to let this release. Is this referring?
No.
No? Okay. Is the level of pressure we're using acceptable?
Yes.
Thank you. I'm going to soften my elbow and we're going to flush over the tissue and come back. Coming back down, coming up into the muscle tissue. And with every pass, the muscle tissue is becoming softer and softer. Now, right here, I've pushed back right into the superior midline of the scapula. This is going to catch Levator Scapulae, which is a muscle that comes right here into the base of the skull. And so we want to release this muscle. You okay here?
Yep.
All right. We've got about 3 minutes left in our session. We time our sessions so that as we're combing through the body, the session time that you've booked, we have a responsibility to make sure that we can get to all the injuries that need to be gotten to within the time frame of what you've booked. You can see some little movement of the body there. It's just real tender for him. Deep breath in. Good. What I'm going to do is bring you guys right around here and let you see this last release. I'll give you a different angle because that may help you a little bit. A little bit of topical lotion here. First thing we're going to do is warm the tissue up all along through the spine. Going to go slower. Begin to go deeper. I'm going to sharpen my elbow just a little bit right there. You okay?
Mm-hmm.
We're going to hang out here for just a moment, same pressure. Muscle tissue is very sensitive. About as sensitive as a 6-month-old child. So when we're going into a muscle that's injured and we touch that muscle that's injured, we have to wait because that injury may tighten up and kick us out, but what we're looking for is for that injury to begin to release and begin to relax and go back to its normal length. And what I'm noticing right here, right now, is that this muscle is beginning to release. Little jostling here. Are you able to feel that releasing?
Yes.
Perfect. Thank you for that information. Constantly, we are engaged with our clients and patients while on the table. We help you be part of what is happening because, it's your body. I mean, come on. We want you to know more about your body. We want to educate you as to where your injuries are, how we're helping you heal. I've got about a minute left, just kind of flushing through here. Deep breath in. And then we're going to remind our client that it's going to be very important today that they drink a lot of water. And by a lot of water, it should be half your body weight in ounces per day. This will help flush the tissue because we have released. You can see all this through here and all the new markings through here where we've released all of the spinal column, the muscles, splenius capitis, levator scapula, rhomboids, trapezius, about 28 different muscles that we've been able to release right here. Also, we would let our client know that they will be a little sore. The soreness will feel like you've worked out. You will never feel bruised from a session with us. That's typically when a therapist either doesn't know their anatomy or they're not listening to the body and they're being really aggressive when they go into the tissue. That's what causes that feeling of being bruised. And then we're also going to have our client track and journal what they're feeling, because this will set the stage for the next session when they come back in so that we can take them to their next level of healing. So guys, from Brian at Revive Live Spa, it has been a pleasure spending time with you this morning, and I am excited to tell you that we are fully open. All services of Revive are now open. Guys, y'all have a wonderful day, and we'll see you again really soon to continue to be your home for healing. Continue to restore, renew, and revive your life from the inside out. Have a wonderful day.